Gmail पे ना आपके? So I think what we do is, if you want to sit first and give introduction, then I will come and you can ask questions. You invite me, I'll come and sit. That way, I think we can start. We can introduce both of us, whatever, you know. So, we get. I think we can just have some chairs here. You do will be masked, I can be unmasked. Okay. You do have to mask, I'll be unmasked, you know. Once you introduce, then you will come and share it here.
Good to go.
Yeah, bismillah.
Alhamdulillah, salatu wassalamu ala Rasulullah sallallahu alaihi wasallam. Brothers and sisters, this is Muslim Atiq, and I'm here to kind of get in touch with you and kind of get you to speed about what we at MCCST have been planning and thinking about in terms of reopening the masjid, inshallah. We do want to link that with some of the decisions we took early to postpone our regular activities at the masjid. Although, as you know, alhamdulillah, we have been trying to do our best in the current circumstances to continue to connect with the community as much as we can. As you all know, Sheikh Muhammad El-Hewizy, Jazakallah khair, he has been very active. He's actually been at the masjid throughout this time. During Ramadan, he's been continuously being in touch. During Eid time, he's been doing that. And we have been very closely watching the situation. Of course, it was not an easy decision, but I just want to share something from my heart. You know, in Hadith, called Nabi sallallahu alayhi wasallam, al-hikmatu dhallatul mu'min. Wisdom is an asset of a mu'min. And it further goes on to clarify that wherever you find wisdom or think from wisdom, you should grasp it. So whatever decisions we have taken or we continue to take are based on the wisdom or the or in the information we have from, of course, the scripture and the hadith, but also from the information we have at hand. We have tried to do and the best we can to synthesize this to make the best decision for our community, inshallah. Of course, it may not have been the perfect decision, but it was the best decision we could have made by our understanding for our community. I do want to quote one very beautiful riwayah that I think has been under-recognized, and it comes to the time of Sayyidina Umar radiallahu anhu. He left Medina on his trip to Syria. At the time, there was an outbreak of plague in Syria. And it has been narrated from Abdullah ibn Abbas radiallahu anhu that he stopped at this place called Sar. And he was in this confusion mode whether we should enter Syria or not. So he asked some Sahaba to go back and ask the people from Muhajirin, what should we do? And there was a split between them. Some of them said we should enter Syria. Some of them said, no, we should not enter Syria because you're going to expose everyone. Then he sent another caravan to consult with the Ansar of Medina to make a second discussion with them, mashwara with them. And again, there was a split. Some of them said we should enter Syria, because we have made the decision to do that. And some said, no, we should retreat because it's not good to expose everyone. So he made a third mashwara and he sent a group of Sahaba to the elders of Quraysh at the time who had converted to Islam during the time of Fath Makkah. And they basically said the same thing, to retreat and not to expose everybody to the plague. At that time, he made an executive decision. And on the other side was Sayyidina Abdullah bin al-Jarrah, very, very brave and very honorable Sahabi, as you know. And he kind of said, Ya Umar, are you fleeing away from the decree of Allah subhanahu wa ta'ala? Meaning whatever Allah subhanahu wa ta'ala has for you, meaning if he has death for you or something which is not very favorable, are you running away from him? And Sayyidina Umar radiallahu anhu gave a very, very wise decision and an answer. And he said, Abu Ubaidullah bin al-Jarrah radiallahu anhu, I was not expecting this from you. If at all anything, I'm moving from the decree of Allah towards the decree of Allah subhanahu wa ta'ala. Meaning I'm moving based on the wisdom I have from consultation, based on the facts. This is still the qadr of Allah subhanahu wa ta'ala. So I just wanted to clarify this in our tradition, 1500 years ago. Alhamdulillah, epidemiology and decisions made based on facts has been our asset, and we try to do our best to relate to them in every possibility. Without going into further delay, I will go ahead and introduce my honor to have Dr. Jawad Nazir with me here. And just because the setup will have to go back and forth, so I will disappear and he will come over and take the stage. Inshallah, we will go over some of the basic questions about COVID-19, what are our plans of opening the masjid. So you might hear from me in the background, and you will see Brother Jawad sitting over here. If in the meanwhile you have any questions, please feel free to text them to Sheikh Muhammad El-Hewizy, and he can relate them to us, and we'll do our best to inshallah answer them. Jazakallah khair. And I just want to mention to you, we both had masks on. We had to take them off just for the purpose of this event.
Jazakallah, Brother Muslim. Thank you very much. And as Brother Muslim introduced, I'm Dr. Jawad Nazir, and despite being a board member at the Muslim Community Center for several years, I'm also an infectious disease specialist. So I'm kind of humbled and honored by the request of my brothers to come today and answer some questions to help better understand our community about COVID-19, and also why it is important for us to take these steps as we opened our community center for prayers and other activities. So I think, Brother Muslim, I just want to first give a little background about this infection, and then we can go over some of those questions. So as we know, just in a span of 6 months, this is a new virus, was first identified in China in around December 2019. But just within less than 6 months, we have more than 6 million cases all over the world, in every country in the world. And during that time frame, we have more than 400,000 people who are dead, including more than 100,000 in USA. So this is a very significant and a historic pandemic. And I just want to give this background so we understand the severity as we listen to things in the media and as we open up. It is very important for us to understand that background, that this is not over yet. And for us to survive and to protect our loved ones, we have to take all the precautions so we can be safe. Safety is number one priority for the MCCSD management. And it has been a very tough decision to open, because if any one person gets sick due to wrong decisions, we can be held responsible in front of Allah subhanahu wa ta'ala. So that's why we have to take some tough decisions. They are not popular decisions, but they are tough decisions. So just want to give you a background, Brother Muslim. I'll be happy to answer any questions.
Inshallah. Yeah. So, Brother Jawad, what is it? Why is it so novel? What is so unique about this virus? Some people would say, well, you have flu every year. Influenza is a big problem. A lot of people in the United States die from influenza. We have the common cold. Even young people die from influenza. So what is so unique about this? What's all this hue and cry about?
Yeah, so this is a very good question. So I think, as you said, it's a new virus. But as I give the background, much is not known about this virus. So as we have understood about all the other viruses for decades, we have better understanding how those viruses cause the disease. We have better understanding about the drugs which can work to control those infections. But because this is a new virus and it's only 6 months, we don't have complete understanding how this virus causes disease, how it causes all these complications. And we don't have effective drugs or therapeutics to treat it in a timely fashion. So one of the challenge we have is that we are still learning about it in a phase when this is moving so rapidly. It's a very rapidly transmissible virus, meaning infection from person to person in a very rapid fashion. And what we know so far is that it's at least 5 times more lethal than the influenza. So we see about 20, 30,000 people dying from influenza, but in the last 6 months, we have seen more than 100,000 people dying in USA. So it's a rapidly transmissible virus. It is much more deadly than influenza and many other viruses. And our biggest challenge is that we don't know too much how it causes disease, how it causes these complications. And you're right. I think first we understood from China and from our initial studies in USA that elderly people are more likely, which is true. If you are above 65 and if you have chronic medical conditions, you are more at risk to die. But what we are seeing here in this country, in USA, that people of any age are at risk. So, for example, working at Aviram Cannon Hospital, where I work, I've seen young people dying from it. I've seen young people without any medical problems dying from it. So this is why this is so challenging.
So you talked about the transmissibility and the fact that it can go from person to person. One of the things that I run into is the attack rate, meaning the likelihood of the virus to attack another person. And the range is a lot. You know, some people say it can attack 3 people, one person can infect up to 8, 9 people. So the data is all over. How does it spread? How does one attacker, quote unquote, attack another person?
Yeah. Very good question. So I think it is all very variable, but as we talked that this spreads from person to person, the major mode of transmission is via respiratory droplets. So as we talk, sometimes we talk too loud, or if someone cough or sneezes, sometimes we release these droplets in the air, which can be defined as dried up secretions, very small size, 5 microns or more, a small size. But those droplets contain the infectious virus and which they can land on the mouth or nose of the person which is close. And as they get there, people can inhale, it can get into their lungs and cause severe respiratory infections and pneumonias. Now, the major factor here is that how close you are to the next person. So that's where this concept of 6 feet comes. And when we talk about physical distancing, we say every person should be 6 feet away from the other. That's based on the understanding that your chances of getting infected or the attack rate is going to be much higher if you are within 6 feet of the next person. So that brings the value of masking and physical distancing. Also, I think the attack rate depends also on what kind of people are around you. So, for example, if you have 5 young persons without any medical problems around you, maybe they will not get infected, or maybe they will have mild infection. But if you have an elderly person or a diabetic person or someone with a heart problem around you, so depending on the people around you, they may have a higher chance of getting infection.
So, talking about the symptoms, you have mentioned some of the ones that we see obviously in the on the news and on the social media, such as fever and cough. Are these the only two symptoms, or you think it kind of affects the whole body? And if you could just elaborate on that.
Very good question. So I think when it initially started, and it is general understanding of most people when I talk to them, they think that fever, cough, and shortness of breath are the major symptoms. And that is true. They are the major symptoms of this infection. But what is unique about this viral infection is that it has many other symptoms. So like influenza and many other viruses, which predominantly has respiratory symptoms, this has many what we call extra respiratory, like extra pulmonary symptoms outside the lungs. So cough and shortness of breath would be something coming from the lungs. But a symptom could be somebody has muscle aches. He has a lot of muscle aches. He's very tired. Somebody is having severe headache. Somebody with a sore throat. Someone with a runny nose. And it's interesting symptom which has been described with this infection is people can lose their sense of smell and taste. So which is, I've seen a few patients with that. People can lose their sense of smell and taste, which is very, striking for this infection. It can also present with some gastrointestinal symptoms. People can think they have some kind of a, GI bug, but it could be diarrhea, nausea, or vomiting. So one of the challenges, why this is so difficult to recognize is that it can present with a broad range of symptoms. So many people may think, I don't have COVID-19, I may have something else, So then they do not take precautions which are necessary to protect others from getting the infection.
Absolutely. So, in terms of people who are more likely to have serious complications, you had mentioned one group which is elderly, more than, or not so much elderly anymore, but more than 60 to 65 years of age. Is that the only group that we are somewhat more concerned about who should limit their exposure as much as they can? Or are there some other categories as well that you think should be very cautious about any potential complications?
Yes, I think this is also very important to recognize that if your age is just 65 is just an arbitrary number, but you could be 63 and 64, or or you could be above that. But it just means that when you are around that age range, your chances of getting infection and severe complications like severe pneumonia, respiratory failure, hospitalization, or death are much higher. But then what we are seeing from the data since December from China, many other countries, and USA, we have seen there are certain patients with certain diseases who are likely to die. For example, diabetes is a major one, especially if you have uncontrolled diabetes. Patients who have severe asthma or lung disease, like patients may be requiring oxygen, patients who have heart problems like congestive heart failure, patients who have liver disease like cirrhosis, patients who have chronic kidney disease, they're on dialysis. So if they have multiple sometimes these patients have not one problem, they have more than one problem. So there may be someone who is diabetic and has a kidney problem or a lung problem or a heart problem. And we at sometimes, one disease also has many other associated diseases. So their cumulative chance of getting severe disease is much more. Another group I want to mention is patients who are getting chemotherapy for cancers, for example, patients who have transplants. So any disease which decreases your immune system, or if you are on any special drugs called biologics, which decrease your immune system. So some of those diseases can make you more susceptible to get infection, not only infection, but make you more susceptible to get severe complications.
Thank you. So from what I understand, what I read, the treatment is really in infancy. It's really developing, it's really coming up. We have maybe one drug in the market that is only valuable for very, very sick patients. The other ones are, either being investigated or haven't really proven to be very effective. What can I do to just not get into this trouble? What can I do to prevent myself and my family?
So I think we have two questions in one question, and I think I'll go with the old quote, prevention is better than cure. So I think at this point, because we do not have proven therapies, prevention is better than cure. So there are, I think, some things which everyone has to do, and everyone has two responsibilities, not just one. Like when we ask the question, what can we do to prevent? I think everyone has to think, what can I do to prevent myself from getting infection, and what I have to do to prevent a person around me to get the infection. So everyone has two responsibilities. One is he has to protect himself, but he has to also protect people around us. And Sheikh will be very happy to, to listen to that, So I think there are some very basics, hand washing. It's all in our hands, they say. So I think aggressive hand washing, many times a day with water and soap for at least 20 minutes, is important, especially if you are coming out of a crowded place, or you went for groceries and you came back, you went to a public place and you came back, or if you touch certain packages or services, it's very important to wash your hands with soap for 20 seconds or more. Or if water and soap is not available, then hand sanitizers are a good alternative. So I think this hand hygiene is very, very important. Doesn't mean that you have to be outside. Within your house, I think, because you have many other family members and you're doing multiple things, it's better to consider doing that multiple times in a day, so that you don't have those viruses on your hand. Second is not to touch your face and mouth. We all have the habit sometimes to touch our face and mouth. Now, if you had a handshake with someone who touched a surface which had virus, and you touch your face or nose, now the virus gets in and you get infected. So very important not to touch your face or mouth. Third, I think, is the concept of what we call social distancing. I want to call it physical distancing, because I think you can be social, without that. So physical distancing means that whenever you get out, as I talked about, staying 6 feet away from everybody. So you have to avoid crowded and public places, but you have to go out for groceries and drop someone, meet someone for some essential work. You have to go to your work, but try to stay 6 feet away. And that concept is based on the fact that if someone coughs, sneeze, or talk very loud, those droplets, are not suspended in the air more than 6 feet. That's what our understanding is. So your chances of getting infection would be less. Now, this is also important within your house. Within your house, I think it may be important to stay 6 feet away from each other as much as possible. Apart from the physical distancing, masking is very important. Now, I should have been masked, but I think to kind of speak properly, I took the mask off. But it's very important when we go out of our houses and go to any public places, we should be wearing a mask. Mask not only it provides what we call source control. So if someone is talking very loud or coughing or sneezing, source control means that all those droplets are contained and they don't get suspended in the air around you and do not infect other people. Now, if one person is masked and the other person is not unmasked, then the benefit of masking is very limited. And to get the maximum benefit from masking, it's preferable everybody's masked. So if I am masked and you are masked, chances of us getting infection are much less, And when we wear the mask, it's not that we are protecting ourselves, it's more for protection of people around you. So I think masking is really important. And then I think the fourth thing would be to monitor yourself, because as we talked about the symptoms, this is kind of a kind of a tricky virus because it presents with a broad range of symptoms. You have to monitor your health. So if you start thinking that you're having symptoms, you start feeling sick with typical or atypical symptoms, I think you need to separate yourself from others. May have to call your doctor for the next step to see if you need to be tested to know if you have the infection or not. So I think monitoring your own self and your health, I think, is kind of important. The second component of your question was the treatment, and unfortunately, we do not have any effective or proven treatment at this time. There are many studies going on, and there are some good preliminary results from certain medications, such as an antiviral called remdesivir. There is administration of plasma. There are certain other drugs which can be used in the hospitalized setting in very sick patients, but those are all experimental at this stage. We don't know. And that's one of the challenge with this virus, as we talked about, why it's so difficult, because we don't know what works and what does not work. So at this time, if someone gets in the hospital, it's all basic treatment, what we know from before, providing good supportive care, making sure they have oxygen, they have fluids, they have good supportive care. So that's the key, for it. We have hopes there will be vaccine. We don't have a vaccine. We'll just pray to Allah subhanahu wa ta'ala to make it easy to get the vaccine in a timely fashion. I think that will be helpful. So hopefully, inshallah, with the help of Allah subhanahu wa ta'ala, we'll have vaccine and therapeutics, in future.
So when you talk about masks, if I understand, not all masks are equal. They say, well, some of those fancy masks like N95s we use in the hospital, there's a COVID positive patient or very likely to have COVID. Then these are the surgical masks that we use on a regular basis. In a regular basis, and they are likely to be more effective to help with the spread. And then the cloth mask, and if I read the CDC, the cloth mask does not typically prevent you from getting exposed. So my understanding is you should still go back to the very basics of physical distancing in spite of a mask. Is that a correct answer?
Yeah. I think the masking is to protect the other person. So when you go out in public or within your house,
it's a common courtesy.
It's a source control that is kind of containing your own respiratory droplets and secretions, and then you're not suspending them in the air to protect. Now, some of these masks like N95 and PAPRs are mostly highly sophisticated masks and they filter 95% of the stuff. They are mostly in the hospitalized setting to protect you because you're seeing a patient who has proven infection. So although it may not be completely unreasonable to wear a surgical mask, but if you use too much of surgical mask in the community, then the healthcare workers will have deficiency of those masks. So that's why the CDC recommends that cloth masks are fine. But they are masking, you raise a very good point. Masking is not a substitute for physical distancing. You have to do physical distancing and you have to do masking and you have to do hand washing. You don't have to touch your mouth or face, no handshakes, no hugs for now. So I think those are all basics, they are a kind of bundle of care. So where one element of the bundle is complementary to the other element of the bundle. They are not substitute to each other.
Thank you, brother. So just a hypothetical situation, you said no handshakes, no hugs. For example, I saw brother Zishan after like a month. He's very excited to see me. He gives me a good brotherly hug, shakes my hand. I'm trying to avoid it, but he's just very excited about seeing me. What do I do now? 3 days later, I get a phone call. Brother Zishan is sneezing. He has a little fever of 100. What should I do?
I think it's too late now. I think, first of all, the brothers have to control their excitement. I think that's very important. At this time, no handshakes or hugs. But in a situation, I think you raise a very good question. People can get exposed. People can be in their homes. They can be outside in the community, and they can get exposed. So once you get exposed to someone who is sick, then I think you have to, number one, self-monitor your symptoms. If you have any of those symptoms, it may be good to call your doctor and tell them that you got exposed. And sometimes they contact the state health department because there is something called contact tracing. So state want to track all the contacts of known cases, and to break this cycle of transmission, they may want to test you to see if you are positive or not. If you are positive, they may want you to be quarantined or monitor your symptoms. So that brings the question, which is another challenge with this infection, is the concept of asymptomatic transmission. Now, in most infections, you have symptoms. Symptoms mean that you got an infection, you have a fever, you have a cough, shortness of breath. These are the symptoms of infection. What is strange about this infection is that 30% of the people with this infection may not have any symptoms. So I may not have any symptoms, I may be infected. Sheikh may not have any symptoms, he may be infected. So this is called asymptomatic infection. And the problem is that it does not mean that you are not transmitting the infection. Even if you have asymptomatic infection, you are still transmitting the infection to the other person. So they have found that 30% of the infections due to COVID-19 are asymptomatic infections, and they are responsible for about 40% of the spread of the infection worldwide. So that's another challenge, when we talked about initially, is this concept of asymptomatic transmission. So if you know you got exposed to someone, you may have to call your doctor, may have to call state and ask if you need to be tested, and you may have to monitor your symptoms very closely.
Thank you. So that's a pretty high number for asymptomatic infection. So I don't have any symptoms, and thankfully, Brother Zishan did not give me a hug. Should I still get tested? Because it's everywhere. You hear about everybody in the community, everybody outside in the hospital.
Yeah.
What the heck, should I just get tested?
Yeah, I think in an ideal situation, I mean, if we have the testing available for everybody, I think that's what we may consider. But I think one of the issues is the limitations with testing with the state and at the national level. The testing is kind of limited. We hear in the news all the time, we don't have enough tests available. So that's why the testing has been categorized for symptomatic, people. Also have been categorized for healthcare workers because they're in a setting where they can transmit the infection. Also has been prioritized for vulnerable populations, for example, patients living in the long-term care facilities, or people in congregate settings like prisons and shelters. So there is a prioritization of who needs to be tested. Everybody with symptoms needs to be tested. But if you're asymptomatic, then there is a level of prioritization, primarily targeting the highly vulnerable population or populations which are in congregate settings like shelters and prisons and long-term care facilities. But I think in an ideal situation, we would test everybody, but that's not possible at this time. So.
Thank you. Somewhat of a personal question, and I think a lot of us are kind of in this boat, I would say. We have family overseas or in other states, and we like to travel. So I haven't been back to see my family in Pakistan in quite a few months. I know you have family that you like to visit. Should I do that? Should I wait? Should I just watch the situation? What do you think?
This is a very tough situation because, as you said, we all have relatives, back homes, and our parents there, and people are sick, and we want to travel. But I think it's not a wise thing to do at this time, because air travel increases the risk of getting infection, and it's very difficult to physically distance yourself at the airports, and in the plane setting. There's a high risk of transmission. In fact, many of the cases we have identified are due to air travel. Also, I think there are logistic issues, like you may be in an airport, where they want you to be quarantined for 14 days, or there are many countries now where you cannot even get back to USA. There are many countries where the number of cases are dramatically increasing, especially in South America these days. So I think, we all love to travel, but air travel increases the risk of getting the infection, and it may create some problems for you to get back to the USA in a timely fashion. So I won't recommend air travel at this time unless there is a very emergent or essential situation, which can be a personal decision for you and for anybody else.
Thank you. We'll continue to watch. Like I said, as much as we want to be safe for our community here, we also want to be safe for our parents. It's nice to see them, but we don't want to carry the infection with us to them. Indeed, very difficult situations. But again, we have to do the best. Whatever Allah Subhanahu wa Taala gives us the wisdom, may give us the wisdom to make those decisions. So let's come back to where we're at. This place is very near and dear to all of us, and inshallah.
You recommend any food, any drink to strong your immune system?
So Sheikh Muhammad has been hearing, and he actually asked a very pertinent question before I jump on to the next one, and that is any nutritional advice you'd like to give? Anything in particular? I would say even from a life coach standpoint, what can we do to be better adapted? God forbid one of us gets infection.
Yeah, I think there is no specific advice for COVID-19 at this time, but I think it's the general principle of eating healthy and exercise, to make sure you control your body weight and not predispose yourself to diseases, and infection. So there is no specific nutritional supplement or something which will protect you from COVID-19. And I think we all should follow the general principles of good nutrition, balanced diet, proportionate size and exercise, which we all struggle to do, but I think that's what it is.
Inshallah. So going back to the question that I was asking is about the reopening of the masjid. Sheikh has been very understanding, but he misses to see all the brothers here to make sujood in front of Allah subhanahu wa ta'ala together, inshallah. And I always say, may Allah subhanahu wa ta'ala give us the opportunity to get to do that again together, inshallah, and to prostrate in front of him. And so my understanding is we are inshallah starting opening the masjid officially. Any specific precautions that you have in mind, and how do you think we can do best so that we continue to be at our masjid, yet we still continue to watch the universal guidelines, but specific to our masjid?
Inshallah, Brother Muslim and Sheikh, we are going to open the masjid, on June 8th, and as you mentioned, it has been very hard for us and for our community not to have this place open. And it was a very tough decision, but it was taken for the bigger good of the safety of our community. As we open, I think I want to emphasize that this is an interim decision. I think what we are doing is not a permanent policy. This is what we call interim policy, and it is based on the epidemiology, the situation of infection within Sioux Falls and nationwide. So it's quite possible that 2 weeks from now, the number of cases decrease and we make rules a little lighter or maybe a little different, allow more people to come in. Or it's quite possible in 2 weeks from now, we have another outbreak like Smithfield, and now we have a exponential growth of cases, and we may have to, put stop breaks again, So I just want everyone to understand that this is a interim policy. This is not a permanent policy. Now, secondly, this is a phased approach, by which I mean that, we start with certain rules, and as we see the epidemiology and number of cases, we go to the next step. So, unfortunately, at this time, we are not allowing our sisters and our children to come in, which is tough for us because I know many of them do want to come. But, in the first phase, we are only allowing men to come. So certain things I want to emphasize that, the number one thing I want to emphasize that if you are sick or if you feel you are sick due to any of the symptoms I talked about, like the fever, respiratory symptoms, or any of the other symptoms which make you worry that you may be infected, or if you think, Brother Muslim, if you got exposed to Brother Zishan from a passionate hug, I think if you think that you may have been exposed to someone, who may be, infected, then maybe please don't come, because then you increase the risk of giving that infection to other people in the masjid, and as I mentioned, people who have asymptomatic infection can also transmit. So if you have symptoms, or if you have an exposure to someone in the last 14 days who had an infection, then maybe don't come. Secondly,
you will be rewarded as if you prayed in the masjid.
Sheikh says you'll be rewarded as you prayed in the masjid.
Yes, of course.
Yes, yeah. Secondly, it's my advice, and I think it's a personal decision, and I know it will be difficult, but if you are 65 and above, or if you have one of those medical conditions we talked about, like diabetes, heart problems, lung problems, liver or severe kidney problems, or any medication such as chemotherapy, if you fit in any of those categories, please don't come, because you are at a higher risk of getting infection. Not only you are at a higher risk to get infection, you can get severe complications which can be life-threatening. So if you are in that category, consider praying at home, and may Allah subhanahu wa ta'ala give you the reward for that. Third, make wudu at home, and the reason for that is, the place we have is very small. So if we have a number of people making wudu, the concept of physical distancing is not possible. So I think in emergencies, we can make it open. We have certain rules for that, but try to make wudu at home. Fourth, come with your mask. Come with the mask. Sometimes we may not have enough masks to provide it to everybody. You can use a cloth mask or any mask, but come masked when you come in, and try to bring your own prayer rug. And that's important because if you don't bring your prayer rug, everybody can contaminate the surface on which they pray, and sometimes cleaning and disinfecting can be a challenge. And when the next person comes and pray at that site, he can get infected. So it's very important for you to bring your prayer rug. Then I think we would try to have some hand sanitizers available on the front, so sanitize your hands as you get in, and sanitize your hands as you leave the masjid. So those are some of the basic rules. We are advising 18 or less age group and women not to come at this time. So this is all meant to decrease the risk of spread of infection, making sure nobody gets sick and die from COVID-19 within our community. I'm not sure if I missed anything. Yeah, Sheikh is telling us that the khutbah for Jummah will be 10 minutes, and the concept for that is also to decrease the time everyone is exposed to each other, so we'll decrease that. Yeah. Sheikh, you want to come and give some of the final? Yeah. Sheikh, you want to come? We ask you some questions too, so I have some questions for you. Unless Muslim, you have another final.
Yeah, no, I just have one comment. I know some of my family from overseas and some of the stuff I've seen over the internet. They talk about some of the hadiths that refer to some special nutritional components. For example, senna, the herbal extract. In a hadith, it's narrated that Rasulullah mentioned that senna and sunut, is that correct? It's a form of honey that together have a cure in them for everything except death. And it's a hadith. I can testify that senna we use a lot in GI, gastro. It's mainly used as a laxative, and it has really minimum to no side effects. And in the US, it comes as a tablet. Unfortunately, it is not something that is available like per CDC guidelines or things like that. But since it's mentioned in hadith and there is no side effects with it, I don't have. Of course, being a Muslim, I would mention that. Again, being very sure, very clear that this is from the perspective that it's mentioned in hadith. And I know people have asked me about this in general. And since it has minimal side effects, I don't have anything against it.
Yeah. But the Muslim, that's perfectly fine. And I would add that this probably means for every disease, not just for COVID-19.
Yes, very true.
So it's not specific for just COVID-19, but for any disease. And I think there is no harm in taking, as mentioned by Brother Muslim, So Jazakallah, Brother Muslim and Sheikh, for this, I'm kind of humbled and honored to come and answer some of these questions. I hope these help some people. And if anyone has any questions, please feel free to contact me or Sheikh or Brother Muslim, any of us, I would ask Sheikh to come so we can ask him some questions too.
Just you can just finish it.
Jazakallah khairan.
The religious value of not
Dr. Jawad, may Allah subhanahu wa ta'ala reward you and Brother Muslim. And we have to protect each other. This is an act of worship. It's ibadah, not to harm anyone. The Prophet ﷺ said, "La darara wa la dirar." You should not harm anyone. You should not bring harm to anyone. This is the sunnah of the Prophet Muhammad sallallahu alaihi wasallam, and we have to follow the sunnah of the Prophet Muhammad sallallahu alaihi wasallam. Inshallah, masjid will be open on Monday, inshallah. And we, as you heard Dr. Jawad, he said we'll combine Isha with Maghrib and Asr with Dhuhr, and 40 people are allowed to attend Salat al-Jum'ah. 40 people will be allowed to attend Salat al-Jum'ah. جزاكم الله خيرا. أسأل الله سبحانه وتعالى أن يحفظنا وإياكم من كل مكروه وسوء. أسأل الله سبحانه وتعالى أن يزيل هذا البلاء وهذا الوباء من هذه الأرض. أسأل الله سبحانه وتعالى أن يرفع هذا البلاء وهذا الوباء عنا، وأن يصرفه عنا وعن بيوتنا وعن أولادنا وعن أهلينا في كل مكان. اللهم احفظنا بحفظك الجميل، اللهم احفظنا بحفظك الجميل، واسترنا بسترك يا رب العالمين. وصل اللهم على سيدنا محمد وعلى آله وصحبه وسلم، وجزاكم الله خيرا، والسلام عليكم ورحمة الله وبركاته.